14-day incubation period for the novel corona disease or COVID-19 as it's commonly called. A lockdown enforced by the Indian government. Yes, the Indian government has taken the right steps to curb the spread of COVID-19. As Indian citizens, it's our duty to stay at home and obey the lockdown. Because staying at home is social distancing. That is the only solution for us to curb the spread as of now. The vaccinations are yet to come and hopefully it will come soon. The answer is accessibility to doctors. People with minor ailments and chronic illnesses are not able to meet the doctors. Doctors are not able to keep the clinic open. The challenge is that patients cannot access them due to social distancing, which we all have to adhere. Now, what is the solution? Telemedicine is a solution. Yes, guys, I am Dhruv Swamprakasam, the founder of iCliniq, a global telemedicine platform. Yes, that's a question that most of us would have. The government of India has been proactive. On March 25, 2020, the day the lockdown came into force, the Indian government, or more precisely the Ministry of Health and Family Welfare, along with Niti Aayog, released the telemedicine guidelines. Telemedicine is now legal in India, and there are certain rules and etiquettes and guidelines which a medical practitioner should follow. This video is about that. What are the steps a doctor should take or follow to make sure they follow the telemedicine rules? The first and foremost thing is the doctor's discretion to choose a mode of consultation. There are 3 modes of consultation in telemedicine, which the government also says: text, video consultation, or phone consultation. It's the doctor's discretion to choose a mode of consultation with the patient. It's not the patient's discretion here. And also, a doctor can choose to give a prescription or not for the consultation. Of course, for certain type of drugs, a doctor has to make sure he follows the norms. For some types of drugs, a doctor has to make sure he does a video consultation for the prescription. I will talk more about that a little later. Now, coming to the most interesting thing. Can a doctor do an emergency consultation in telemedicine? The answer is yes. If the patient does not have access to healthcare facilities or doctors or hospitals in their vicinity during the emergency, at that time the doctor can do emergency consultations. Otherwise, the doctor cannot do. Yes, that's the thing. Coming back to the patient's rights, a patient can ask a doctor's medical registration number, and also the government says the doctor should tell their number first. Yes, they can use WhatsApp for a consultation. The doctor has to make sure they have all the records of the consultation for future use. Is it possible for doctors to maintain all these things? I would recommend a doctor to use a telemedicine system. By the way, we run a telemedicine system. You can have a look at it by going to the link called icliniq.com/doctor, icliniq.com/doctor. You can register as a doctor and practice on a platform. We have all these rules made easier for you. The patient has to consent for a consultation, even that is inbuilt in our system. Now, what should a doctor do when the patient says, I'm not interested to do a telemedicine consultation? The doctor has to say no. The patient also has equal rights during the consultation through telemedicine. Yes, a doctor can consult a patient with the patient's explicit consent with the patient's attendant or a health worker. A doctor can also use it to consult a patient by talking to another doctor. That is also telemedicine, and that is now totally legal now with the telemedicine rules. Yes, they can prescribe on WhatsApp. You can take a scan of a prescription which you write to the patient, or a simple photo would do, or you can use telemedicine system. The prescription should have certain parameters. It should have the patient's name, it should have his address, it should also have your registration number, and it should explicitly state this consultation was done through telemedicine. One of the key things which doctors ask and which I will share later in the video is the kind of prescriptions or kind of drugs that can be prescribed online. Yes. There are three lists, list O, list A, and list B. Excuse me for reading it from phone. The reason is I want to make sure I get the correct data. Common over-the-counter medications such as paracetamol or cough supplements or common cold medications, ORS packets, zinc syrup or supplements can be prescribed even when you do a phone, video or text consultation. Government would also notify from time to time the drugs to prescribe for endemics, and these things also can be prescribed online through these three modes, text or phone or video. The same, there are no limitations for consulting online. There are two types of consultation which we should also know to make sure the drug prescription norms are followed. It is called as first-time video consultation. Yes, there are certain drugs which you can prescribe only through first-time video consultation. They are ointments for skin ailments and local ophthalmological drops, local ear drops, and also follow-up consult for above medications. There are certain drugs which can be prescribed only for follow-up consultations. Okay, what is a follow-up consultation? Follow-up consultations are consultations that had a physical visit first and then the follow-up is done on video. In that case, you can prescribe drugs for hypertension, diabetes, or asthma. On follow-up, medications prescribed as add-on to ongoing chronic medications or to optimize management can be done. The long story short is that you have to make sure you take effective steps to prescribe online, and these lists can be more clearly seen on our website. The link is here. If you have more doubts, you can always email us on iCliniq and iCliniq.com and ask the questions.